Hello everyone, this is Dr. Jayanthy Ravindran and I have my colleague Dr. Aneesh from Team Tamira here today, debunking facts and myths that you may have about aesthetic procedures, surgical or non-surgical. Let's go for it.
The first one, if you start Botox early, will you be dependent on it?
The answer is no. The effect of Botox will last as long as that particular chemical, neurotoxin, is diluted from where it's injected or removed from where it's injected for its specific function. So you will not get dependent. However, starting early can make you addicted or habituated to getting it repeatedly, which we do not want you to do it. So you can start early as long as you're very well informed and you know that it will last as long as you have the injection. So go for it. You can start at any age. Once you're financially independent and you're using your money to get it done, and you know that it will last only for about 4 months, 6 months, and get it done when you want. And if you want the effect to be lasted, you can repeat them. That don't get addicted to it, make it a habit.
Are facials just for pampering or are they real deal?
Which facial we are talking about? If you're talking about regular facials that you have in the beauty parlor, it's actually for pampering. But if you're looking at the facial that we do at Tamira or in any medical spas, they're all meant for specific reasons. It could be a facial to remove hyperpigmentation. It could be a facial to reduce sebaceous overactivity or oil secretion. It could be a facial for to glow, which means we want to make the cell turnover uniform so that your skin just glows like a Korean glass on your big day. So depending on what this facial is done for, it definitely delivers a result and it's not just pampering. Can skincare routine alone remove the wrinkles from the face?
Probably not, because first you need to understand what kind of wrinkles they are, whether they are shallow or deep, whether there are fine lines also involved. Usually the deeper wrinkles are because of the aging effect, because of which the skin and the tissues have started sagging. So although the skincare routine will definitely add or complement the results, you would definitely need certain kind of treatments such as Botox, some injectables, or even microneedling such as radiofrequency microneedling to improve the results.
You told us the procedures that we would require in addition to the skincare routine to remove wrinkles in the face. Tell us, what is the role of facelift in removing wrinkles?
Okay, so facelift is nothing but a surgical way of repositioning the tissues like I mentioned before. So facelift can help you get immediate results but with a slightly longer downtime. On the contrast, a thread lift can give you certain slight improvement which is more natural and subtle but without having any kind of downtime. We commonly come across thread lifts as the neck treatment for anti-aging purpose. So are they painful and risky?
Any procedures that is done by the guidance of a doctor in a medical aesthetic unit is not absolutely painless like a massage. So there is some discomfort, but it is very, very minimal that you can tolerate with comfort. Similarly, during thread lift, we give some local injections. So injections, I wouldn't say that any of us will say injection is painless. Injection, we do feel the pain of injection, right? So that local injection, then it becomes numb, but there's not much of a downtime at all. So thread lift is very safe, it's comfortable, and it gives quick result, immediate result, and the results last for 12 to 18 months.
And the next one, once you stop taking filler injections, will your face sag more?
The answer is probably yes, because you're adding volume by means of a filler to the face, and when you add volume, depending on how much you're adding, it can cause expansion of the skin. With expansion, like a tissue expander, the expanded skin, once the effect of the filler goes, it can sag. So be mindful of the number of fillers that you're taking and where it is being given. So fillers are definitely has a role in aesthetic medicine, but the number of filler and the type of filler and where it is taken, you have to be mindful of it. You told us a few non-surgical procedures that we can do along with a routine skincare for removing wrinkles. Now, where does facelift stand? When do we do it?
So treatments like I mentioned, Botox, injectables as well as threads are good for mild to moderate wrinkles. But if you are someone who has deep wrinkles or has excessive amount of sagging, then probably a facelift or a neck lift, which is a surgical method of removing the excess skin or doing anti-aging treatment, would be the right treatment for you.
You spoke about non-surgical and facelift. Then why couldn't we just do only facelift in all the patients for anti-aging?
If you are someone who has very minimal amount of sagging or very minimal amount of wrinkles, then probably a facelift or a thread lift might be an overkill. And if you want results that are more subtle and more in line with you having less amount of downtime, then probably thread lift or these non-surgical treatments are the best way to go. And once you age and once you reach a certain age where the amount of sagging is too much, that's when you can consider a surgical facelift or a neck lift. As we all know, there are a lot of different treatments that are available for a given condition, ranging from non-surgical to surgical. And if both of them are giving similar results, then why would someone choose for a surgical option?
Beautiful question. So if a non-surgical and a surgical is going to give you the same result, obviously none of us are going to recommend a surgical option for you, neither would you choose it. So very clearly, for any given condition, a non-surgical option would give limited result, and also a combination of non-surgical procedures can give you a little more result towards what a surgery can achieve. Let's take for example an accumulation of fat in your love handles. Yes, you can do cryolipolysis, you can do some injectable lipolysis, you can also do high intensity focus ultrasound, probably you can also do some radio frequency, but all of them will not give you the same result like a liposuction in that area. So if you are prepared to do multiple sessions of any of these and be satisfied with 20-30% improvement, then go for the non-surgical procedure. But if you want a definitive procedure, then in that case only a surgical solution will give you the best possible result.
If someone is considering enlargement of breast, would you recommend them a body filler instead of using a breast implant?
The answer is definitely no. Let's say you want an enhancement of about 200 cc, that's what will give you a desired result. Then I'm going to inject 200 cc of liquid. There is no predictability of where this liquid is going to remain, how it's going to, or this gel is going to remain, how it's going to react with your body, and how it's going to change the architecture of your breast. So, and we have had patients who've had body fillers and have developed inflammation. I'm not saying that you don't develop complication with an implant, but a time tested and proven surgical method and a permanent surgical method for breast enhancement is definitely a breast implant. We could consider fat grafting, understanding the limitation, but definitely no for a body filler for breast. Yes, body filler may have a role. Suppose you have done a procedure and there is a little contour deformity and you want to inject a little small amount of filler in that position. Yes, you can consider. That could be a role of a body filler, but definitely not as a one-time fix for an enhancement of 200 cc, 500 cc with a filler. Can an enlarged breast, a very big breast, be reduced in size with just liposuction?
Definitely not. So an enlarged breast is because there is excess amount of fat as well as an excess amount of glandular tissue which has hypertrophied or increased. So when there is gland as well as a fat present, a liposuction can only address the fat component. So definitely the fat can only be addressed with liposuction and the gland needs to be excised or removed with the help of a surgery which is called a breast reduction surgery.
Is there a difference in doing a gynecomastia surgery on a bodybuilder versus a normal individual?
Yes, definitely. So a bodybuilder would have definitely tried everything and would have lost all the fat that is necessary to get the shape, but still they are looking for that perfect shape, and that is most likely because they have some stubborn fat in certain areas and also they have gland. So the gland can be addressed with the gland removal, and it also is important to make sure that you do the liposuction in the right areas to get rid of their stubborn fat and create the perfect positive as well as the negative shadows that are necessary to obtain the perfect shape.